Welcome dear learners. In today's video, let's solve this interesting reasoning question. Why is hemoglobin normal in the first hour after massive acute hemorrhage but decreases later? Imagine a patient loses a large amount of blood in an accident. You would expect the hemoglobin to fall immediately, right? But that does not happen. In the first hour after acute hemorrhage, the hemoglobin may still appear normal. Why does this happen? Let me explain. Now, the blood contains two main components, right? The red blood cells and the plasma. During acute bleeding, both are lost together at the same time. So, immediately after hemorrhage, the number of RBCs decreases and the plasma volume also decreases. Because both are reduced proportionally, the hemoglobin concentration initially remains almost unchanged. Think of it like this. If you remove half a glass of salt water, both salt and water are lost together, right? The concentration of salt in the remaining water remains unchanged. Exactly the same thing happens in blood initially. Later, the hemoglobin falls. Why does that happen? After few hours, the body tries to restore blood volume by shifting fluid from interstitial space into the blood vessel. And it is very important to maintain the blood volume to ensure there's adequate blood pressure and there's continuous oxygen supply to the vital organs. That is why, as a compensatory mechanism, body tries to shift the fluid from interstitial spaces into the blood vessels. And as a result of this, the plasma volume increases, but RBCs are still low. Now the blood becomes diluted, right? This is called as hemodilution. And finally, the hemoglobin concentration drops. And since hemoglobin concentration is normal in the initial hour after acute hemorrhage, doctors never rely on early hemoglobin values in trauma patients. Instead, they look at clinical signs like pulse, blood pressure, pallor, and shock. And for this reason, this question becomes clinically relevant. And this is the physiology behind massive blood loss but normal hemoglobin levels.